Hello friends, let us learn about a new topic today, that is CBD strictures. That is common bile duct strictures, or it is also called as biliary strictures. So what are the causes of these strictures? The causes are mainly divided into postoperative causes, which is common in 80% of the cases, or it can be inflammatory causes, which can occur due to recurrent inflammations, or malignant causes, and finally traumatic causes. So in postoperative causes, it can be due after cholecystectomy, here laparoscopic, it is common in 0.8%, and open it is common in 0.3%. Okay. Then the second one, biliary surgery. It is common after biliary surgery. Third, gastrectomy. Fourth, liver surgery. And the fifth one, duodenal and pancreatic surgery. Okay. Now, what are the inflammatory causes? The inflammatory causes are recurrent after. This is after recurrent attacks, not just one attack. So, what are they? Recurrent attacks of common bile duct stones, or parasitic infestation, or it can be primary sclerosing cholangitis. Okay. What are the malignant causes? That is cholangiocarcinoma. So these are the different causes for common bile duct strictures. So first, let us learn the classification. So in that, the most common classification is Bismuth classification of biliary stricture. So what do you learn in this Bismuth classification of biliary stricture? So in this is the liver, duodenum, and then here this is the liver, and this is the duodenum, liver, duodenum. So first we will write about these three. First, the first Bismuth type 1 is all the above parts are normal in this, and there is stricture in the common bile duct, that too low common bile duct stricture, and here there is pancreatic duct here. This is type 1, low common bile duct stricture, with stump proximal to stricture is more than 2 centimeters. So this stump which is proximal to stricture, this should be more than 2 centimeters. That is type 1. In type 2, this is the normal one. The stump distal to the stricture here, this is less than 2 centimeters. This part is less than 2 centimeters. The part proximal to the stump, the stump which is proximal to the stricture is less than 2 centimeters here. Here there is middle common bile duct stricture with proximal stump which is less than 2 centimeters. Then type 3. This is called as hilar. So here the stricture is present at the junction or confluence of right and left hepatic ducts. So stricture at confluence of right and left hepatic duct. So this is called as hilar. Then part 4. In part 4, the right and left ducts are now separated. There are separated right duct and left duct, and there are strictures over there. So the stricture is either in right duct or left duct. So stricture in separate right and left hepatic duct. Okay, now the 5th type. Here this is the liver, this is the gallbladder. So here the stricture is present this is the normal one. The stricture is present in the intrahepatic part. So there is stricture here and there is stricture here. So in part 5, the stricture here is involving intrahepatic duct. Okay, so this is the Bismuth classification of biliary tree. So what are the clinical features that you see? Because of the stricture, there is obstructive jaundice, and then there is pain. There are features of ascending cholangitis. There can be profuse persistent bile leak can be there. So how do you investigate it? What are the investigations that you do? You can do ultrasound abdomen to find out the stricture, and you can do liver function test for hyperbilirubinemia, and you can do ERCP and MRCP for exact location of the stricture. These can be done. And how do you treat it? Treatment number 1, through ERCP stenting. That is, here you will approach the this is the liver here. You will approach the strictured part through the this is how you see. You will approach, this is the strictured part. Think that here there are stricture. So this strictured part you will approach through the endoscopic retrograde cholangiopancreaticography, and then you will keep a stent here. Okay, so that is ERCP stenting. The second type is choledochoduodenostomy can be done, or you can also do choledochojejunostomy. So based on the location of it, you can do drugs NY hepaticojejunostomy. Okay, So thank you guys for watching my lecture. If you have any doubts, please comment it in the comment section. If you feel something is inadequate in this lecture, even then comment it in the comment section. Thank you for watching my lecture. Thank you.